want to talk about a couple of things that I think are important that we begin to highlight, and we begin to talk to the people of Arizona regarding access and regarding the Medicaid changes and potential cuts that can happen. The governor's proposal for Medicaid/access is very broad, and has the potential to cut hundreds of thousands of people from access, and it will likely end up with a cut of about 200,000, if not more. The current program operates until August 1st, right? Yes. 2011, and so after that date is when most of the cuts will begin to roll in. You're going to hear from Access and from the governor's office that no decisions have been made. We're holding the line. We're not going to cut anybody. We're doing everything we can. But implicit in that, in the decision and the authority that they're asking for, because they're asking for broad authority from the federal government. And we are working with CMS and the feds to say that that broad authority has to be checked, that there has to be a process. We're asking for a 90-day comment period where the people of Arizona and those affected by the changes in access have an opportunity to comment about the effect of these cuts. We're also asking that there be no automatic waivers, that there be a process that allows input from various stakeholders, such as, for example, the hospitals, that realize that these kinds of cuts are going to have an adverse effect on them. Persons with disabilities, persons in long-term care is the focus of this discussion today. Implicit in what the governor and the legislature are asking in this broad authority is the implementation of new fees, additional co-pays, additional penalties, more frequent re-enrollment periods, and the 5% cut in provider reimbursement. Those taken unto themselves, plus the broad authority that the governor is asking for, that in the future additional cuts can occur and additional changes to the program can occur. We all understand that these are difficult financial times, economic times, but it's very short-sighted to look at Medicaid as a sole, as one of the primary areas for the reduction of the budget, because it's a self-fulfilling prophecy. It'll only get worse. Potentially 30,000 jobs in this state that are responsible for the care of many people in Medicaid that need that care will be lost. For every dollar we match, the federal government matches 2 to 3. There's a net loss of $1 billion during the course of these changes. And so when the governor and the legislature says there is no appreciable change you can see right now, but looming on the horizon is some very severe changes after October. And we're here to bring that information, and there are folk here who are much more in tune with the issue, that have worked for a long time, and we've been going back and forth with CMS at the federal level about Arizona and Arizona's unique situation having the access program. And one of the issues that we want to make sure is that there is no blanket waivers until we understand consequences. Because to give a blanket waiver and then to say a year from now there are consequences, that they have to be understood and they have to know what they are right now, so that people will know. And who are the people most affected earlier? The most vulnerable, the most in need of attention and care on a daily, and in some instances on an intense way. Those are the people that are going to be affected. You know, it's so easy to look at access and Medicaid and say, it's the poor people. Let them eat quiche. They'll figure it out. On the contrary, the 40% of the people on access are people like me and you. Through a catastrophic, something happened in their lives. They find themselves in need of support. They find themselves in need of this program. From middle class, health crisis, to having to depend on Medicaid and access for your quality of life and your sustenance. They didn't ask to be put in that position. Persons with disabilities are part of that category as well. So today, let me ask now Peri Jude, Executive Director, Arizona Center for Disability Law, who have not only been leading advocates, but leading a legal fight on access and the cuts and the waivers.
Thank you for being here. My name is Peri Jude Radecic. That's PERIJUDERADECIC, and I am the Executive Director of the Arizona Center for Disability Law. We are a advocacy organization that provides legal rights for persons with disabilities to be free from abuse, neglect, and discrimination, and to have access to education, health care, housing, jobs, and other services to maximize independence and to achieve equality. We are here standing with the Pima Council on Aging and Congressman Raúl Grijalva to talk about what is nothing but radical and in some cases completely unconstitutional changes in access coverage that the state has proposed to the Centers for Medicare and Medicaid Services. Our state is taking a hatchet to state Medicaid services in our state, and we must oppose those changes. These are changes that would increase co-payments to poor people. Poor people do not have $3 and $5 for a prescription. We have a person here today who could talk about what that means to try to find a couple of dollars, and if you are on $600 or $700 a month, to try to find a couple of dollars for a copay is the difference between eating a meal and paying for a prescription. And I mean eating a meal or paying for a prescription drug. It is the difference between accessing a doctor that month or taking a bus to maybe a part-time job. Our state is taking a hatchet to critical services. This is the difference between a copay or taking a bus to a job. We are talking about negative and disproportionate impact on people with disabilities. We are talking about risking institutionalization for people with disabilities. We have come a long way since the 1970s for building home and community-based services. Mark Mendibles will be talking about the risk he faces of institutionalization because he receives home and community-based services in Arizona, and what this means if the state is going to cut provider rates. It means providers are going to close their doors. It means providers are going to close their doors. And how is Mark going to get the services he needs to stay in his home and live independently in the community? It means turning back the door. It means taking a hatchet to critical services that we have fought in the disability community long and hard for since the 1970s.
People like me have to continue again. I'm bad. Without these services, I can't get myself dressed. I can't feed myself. I can't live. I cannot live. And these people have no idea what they're doing because they're up in Washington and Phoenix and they don't see how people like me live. I can't work.
You'll have your chance.
I'm sorry.
You'll have your chance. So at the Arizona Center for Disability Law, we are exploring all avenues, including litigation, to fight the good fight to keep critical health and human services in Arizona. And so we want to thank Congressman Grijalva for all of the work that you have done for us.
Thank you. One of the reasons it's here is that Families USA this month released a report entitled Cutting Medicaid in Arizona, Harming Seniors and People with Disabilities and Those Who Need Long-Term Care. That's available as well. And when we got this report specific to the state of Arizona, and having been following this issue from its inception and being frustrated by the lack of attention from CMS to the very unique and different situation that we have in Arizona, we decided we're partnering with the center and Pima Council on Aging to make sure that this message doesn't get lost down the road, especially with those decisions coming in October. Let me now take the time to introduce my good friend, Mark Mendibles, board member, Arizona Center for Disability Law. Thank you.
First of all, thank you, Congressman. I'd like to apologize for the outburst, but these people need to realize how I'm being affected, and people like myself, the people can't even get out of bed without these services. They have no idea how people like me have been affected. I need help getting dressed and eating. Without these services, I can't live. I cannot spend the rest of my life in a bed. I have to live. I have to make a living. They have no idea what I have to go through. If these services are cut, people like me who can speak for themselves won't have a voice, and we're human too, and they're taking the human out of society. I want to be a protected member of society, and I can't do that without these services. I can't live without these services. I can't even get out of bed without help.
Thank you, Mark. You know that there's Mark's one of the.
Sir.
Not be sorry about. Mark's one of the toughest son of guns I know, and there's this thing in Spanish, you know, Mark no se deja, which means he's not going to get pushed around.
Right.
And he's a great advocate, and let me introduce a really good friend and someone who is an advocate for the elderly, and the Pima Council on Aging has set some standards, been a wonderful advocate, continues to be that. Stewart. Don't mind some comments. Thank you.
Thank you, Congressman, for inviting me, and thank you for the Arizona Center for Disability Law for inviting me. We've been working together on a number of cases, and while today we're talking about how bad things might get in the future if these plans are implemented, I have to tell you that we're already seeing the effects of the cutbacks of funding for services. We're already seeing what happens when you take away staff from the agency that provides access services. The staffing pattern at Access is much less than it used to be. We used to be able to have advocates who worked at the Access program. At this point in time, it's difficult to make a phone call and have someone answer your questions. It's difficult to have anybody do it. We've been told that the staff there sometimes has a caseload of over 500. In our modern workplace, these are folks who are now working out of their homes. We've had reports of people, because they're working out of their homes, they don't have direct supervision. They're using cell phones instead of having someone to ask. In some cases, they seem to be making up the policies instead of going by the legal policies that Peri, Jude, and her organization force them to abide by. We have a number of cases right now where people have been denied medications or therapies. Some of these folks have suffered from strokes. They would like to get enough therapy to recover and be able to regain their participation in the community. These cuts are limiting their access to the therapy. They're being told that they've had enough, that they can't get the therapy that their doctors say that they should get. So it's not only the future, it's adding this on top of the cuts and the withdrawals of funding. Pima Council on Aging over the last 2.5 years has lost about $1.8 million in funding for home and community-based services. And those are services that help keep people in their homes and are much less expensive than what happens when they get ill and wind up being hospitalized. So we're very concerned and watching very closely. And what is interesting is, because we don't know where and how the cuts are specifically going to take place, it's difficult to challenge them. And that's why that waiting period, that explanation period that the Congressman is speaking about is so important, so we will know how to adjust, how to defend our clients, and how to deal with those things in the future. Again, thank you for the opportunity.
Can you say your first and last name and your title?
Oh, sure. I'm Stewart Grabel. I'm the Ombudsman at Pima Council on Aging. It's Stewart, S-T-E-W, Grabel, G-R-A-B-E-L.
Thank you.
You know, the reason for this conference is for not for the sheer sake of exaggeration, and not for creating a tempest where there isn't any. We're talking about very real people finding themselves in a limbo right now as to what is going to be their status and their security for the rest of their lives, as these programs are talked about and will change. There's no question about that. So in anticipation, and maybe I'm guilty of an anticipation of the worst, then we need to prepare. And that's why this, along with other gatherings we'll be having, is to put pressure on CMS to have a comment period, to have an assessment as to what these proposed anticipated cuts and reductions and changes of criteria are going to have on people, and to let the advocates in this community to give them the forum and the opportunity to make their case as well. So with that, let me open it up for any questions that the press might have, and the people that know more, my three colleagues here, will be glad to answer them for you.
When the average person looks at Mr. Mendibles, they may be skeptical that his benefits would be cut, that someone as challenged as he is would have their benefits cut. What sort of risk would he be at in this situation?
Sure. Right now, under what the state is proposing, or what the state has already done, The state has already cut provider rates by 5%. They are proposing to cut provider rates again in October. When Mark's provider rates are cut, it puts Mark at risk because the providers that give Mark services are scrambling to make ends meet. It means that providers are trying to staff their offices with staff that are going to probably be paid less, may not have backup services, and may have to shut their doors because they can't make ends meet. It means less providers to provide services for Mark. That's what puts Mark at risk right now. If certain proposals actually make their way through at the federal level, we're talking about a whole nother risk. But just at the state level right now, it's providers shutting their doors, it's providers making sure they have enough qualified staff to provide Mark the services that he needs.
And if those unavailabilities happen, what then?
I'm left in bed. I'm left to fend for myself, and I can't dress myself. I can't feed myself. I can't even get out of bed. And I cannot spend the rest of my life in bed. I have the dreams that I want to follow. I have things I want to do. I cannot spend the rest of my life in a bed. I have to live my life. I have to educate people. I have to educate people about my life. People like me. I'm sorry.
You compound that, the 5% cut to providers, add potentially additional cuts to providers in October. You compound that with the fact that Medicaid and access reimbursement, Medicaid reimbursement is the lowest already. And so it's always difficult to get providers, especially in a skilled area, in a very specific area, to continue to want to be in that Medicaid pipeline to help people because of the continuing loss of reimbursement as it goes down. So for them, it becomes a bottom dollar. And in partial answer to your question, what happens if that provider can't? Then that service is not available. And that's where I think counsel said that's when you place that person further at risk.
What's Mark's last name again, I'm sorry?
Mendibles.
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 Thank you very much. Congressman, I know you talked to the governor's office. They're going to say we don't want to make these cuts. The budget is such, though, that we have no choice. And I'm sure their response to you in less than kind terms behind closed doors would be, what does he expect us to do? What does Washington want us to do? We just don't have the money. So how do you, when they come back with that, how do you answer it?
At the same time that we were talking, the governor and the legislature were justifying the $528 million cut, initial cut to access. They were also passing a corporate tax break of $538 million. One would suggest that was a potential wash, and you could have kept the intent of these programs. Number one, I think it's essentially the same tax policies and the same budget priorities that the federal government is struggling with right now. And I really, you can't at the same time be passing legislation that wants to undo any availability of Affordable Health Care Act applying to people of Arizona. That's going to cost money. And to listen to the hospital association, to listen to the chambers of commerce that are approaching the governor and the legislative leadership and telling them this is going to break us. With people coming off the rolls of access, the hospital visits will increase, emergency room admittances will increase, reimbursement will go down for providers, they'll want less people, And so they're saying there's an economic issue here. And it's been proven over and over again that the Medicaid dollar, access dollar, that circulates in the community to providers, to support organizations, to agencies, is a 1-for-3 match. And so it is probably one of the better economic stimulus packages that you've seen in terms of how that money circulates. So I would say to the governor, if there are really definite plans in October, after October, then I think we should be disclosing those plans now. Because as Stewart well said, how can we prepare and how can we defend our clients if we don't know what they are? And this suspended animation discussion by the governor is not good for anybody. It's certainly not good for Mark. It's not good for the people that Stewart takes care of as well. I would suggest that. The other one is why the broad request as part of the waiver process for unilateral power on the part of the governor's office to decide what in the future will be cut, changed, and what copay rates will happen, and what fee rates will happen, and what reimbursement rates will happen. I think that would do a lot to stabilize the system, because again, you have this lingering request on the part of the governor. And let's look at track record. I mean, that's part of the decision here too. And that's part of the apprehension that I have. There is a track record we're following here. And when it comes to health care, this is not a priority issue for this legislature and this governor. And that's why we're approaching CMS to say, you must have that 90-day period of comment. You must have your regional representatives come in and assess the fiscal impact to the state and hear from the community most affected before you blanketly continue to give these waivers. That's why for me, that's why the pressure's on that as much as anything else.
There was so much attention focused on the transplant cuts. Now that there's a promise that they're restored, are you concerned this broader issue might slip under the radar?
Yeah. Yeah, I don't have no other question other than yes. That there's been an appropriate decision made on the transplant, a good decision made, but that doesn't mitigate everything else that's on the table. I'm glad, but we still have that up in seasons.
I want to make one point. People who are elected to represent their constituents are elected to come up with plans on how to solve problems. Who they place the burden on becomes an issue. So who caused the deficit and who is expected to pay for the deficit really become an issue. And that issue is, should elderly and disabled people pay for the deficit by losing the services and the benefits to which they'd otherwise be entitled? Or is it not the role of the government to come up with a way to provide those services? We judge societies on how they care for their children, and education has been hit terribly in this budgetary crisis. And yet, these are not the people. We don't have children who are taking out phony mortgages. We don't have children who are overextended. We have very few elderly and disabled people who are taking part in that process. And yet, that's who the burden seems to be shifted to. And we need to be cognizant of that and figure out a way to do it. And if they can't figure out a way for government to function as it should, then they should allow other people in.
What they don't realize is that we're essentially paying with our lives. They're gambling with our lives, and they have no right to play with our lives.
We've written, the Congressman's call for transparency is appropriate. There hasn't been any transparency in the state around our budget process when it came to Medicaid. The hearings were in the middle of the night. They had one hearing on the access proposals in Phoenix with little notice to the public, and so I think the Congressman's call for a 90-day public comment period for our state is a good one from the Centers for Medicaid Medicare. I hope they heed his call. We have our letter that we sent to Medicaid and Medicaid's response from the federal government here that we can make copies for you available. So I wanted to make that.
One question. Monica Corey from Access responded to this study from Families USA. She said that there were errors in it, including that there are no eligibility changes that impact the elderly or disabled, and there's no caregiver hours for the disabled that are being cut back in the cuts. So what specifically, I'd like you to respond, and what specifically are you guys concerned
Well,
about?
we take calls every day in our office from people with disabilities. Again, while I think the state would take that position, we would disagree because we get phone calls every day from people with disabilities who are having their attended care services impacted by this. And again, it's the provider rate cuts that are coming in indirect ways. And so I think I would disagree with that.
I would ask you to, and it's not the state employees, it's not the eligibility workers who are doing this, it's the systematic squeeze. It's the lack of people who are available to answer questions. It's the length of time it takes an individual to become eligible. If you ask anyone who works as an advocate in the field, has the atmosphere of helping someone become eligible for the services changed, their answer is going to be very different than the answer that comes from Access. Technically, Access is exactly right. They haven't said that the guidelines have changed, that they're tighter. But those of us who are applying for the services and helping others apply for the services are seeing that slowdown, that delay, that lack of a response that we used to be able to get. And that's not the fault of the workers, of the employees, it's the fault of the system, of those people who are telling the employees what and how they need to work.
Yeah, and then that response is anticipated. We have 96,000 seniors, low-income seniors, about 154,000 persons with disability that depend on Medicaid's long-term program. And to say that is not going to be effective is not true. It's disingenuous. We have the squeeze that Stewart talked about and that council talked about happening now, and an anticipated additional squeeze. And we can't ignore the continual cut in reimbursement for providers. That is going to have a direct impact on those 250,000 people that the report talked about. Because when you limit the options, you almost also limit the ability for people to get services. So they can talk around that part of it. They can talk around in circles, but you can't ignore those specific points. Current squeeze we're feeling, potential squeeze that hasn't been disclosed, and cuts to reimbursement for providers one on top of another. Those are going to have an effect, and you can't deny it. And to say that it's not is not telling the truth. And that's why we want that 90-day period. That's why I want CMS to do a fiscal analysis and an impact analysis on how. And then we'll be dealing with a set of truths. Thank you very much. Appreciate you being here.